I'm Dr. Mohammed Jiva. I'm a Chief Exec for Rochdale and Bury Local Medical Committee and a GP up in Middleton.
And you've been talking about 7-day services in the conference today. What's your perspective on that?
Well, in my area, in the Rochdale Borough, we offer 7-day services from December 2015. We offer 72 clinics a week. That's GP and nurse appointments. And associated with it, it's routine clinics with access to the full medical records. And we also provide diagnostics around smears, bloods, ECGs, spirometries, other things. And these results don't go back to the registered GP. We have the technology in place via a laptop with EMIS loaded up to be able to access all these results so that it isn't additional work for the registered GP, but it's convenient for the public. And the feedback we're getting at first hand from the public is that's what they want. Sunday's not used well, and that seems to be a national issue. But as far as Monday to Friday is concerned, we run clinics till 9 in the evening. And on Saturday, we have 3 clinics from 9 in the morning till 9 in the evening. And the patients are grateful. So I think what we do need to do is, as clinicians and as leaders, clinical leaders, we need to listen to patients firsthand, which I've done in consultations, rather than banging the drum about research and studies about specific identified cohorts that may have been asked the question. And it may be a small population, but the fact that the person working away, the one who's a teacher that can't take time off in school time, they all have health needs that need addressing. So our clinics are full, and I think it's something that the public does want. And it is about what they want, not what we want.
Obviously, a lot of scepticism about 7-day services among your colleagues here. What do you say to those GPs who say there isn't enough funding to go around for a 5 or 6 day service, let alone a 7-day service, and we need to get that right before we start thinking about expanding to 7 days?
Well, interestingly, in my patch, as I say, 4 clinics over the borough. Many of the clinics' appointments, sessions are booked by GP principals who work within the borough. Our nurse appointments are delivered by nurses who work within GP surgeries within the borough. And yet they get paid additional funding, but it's not that these GPs are walking away saying we've had enough during the day, so we're not going to do evening clinics. They are wanting to do it, and because we are all on one EMIS web system, it does allow us to carry out some of our paperwork activity in the evening and weekends when we're doing these additional sessions, when we get a quiet period in between patients. So this is something that GPs, principals, are asking for, and in my area, the demand is so high that as 7-day clinical lead, what I've got agreed with the CCG and the GP Federation is that the principals within the borough and the nurses within the borough and the administrative staff who man the front desk all are given access to the forthcoming rotas 2 days before they go out to anyone else outside the borough, to give them the opportunity to ensure as many clinics as possible are booked by GPs, nurses and admin staff who work within the borough to try and retain some element of continuity.